It is Cervical Cancer Awareness Month, and today we're discussing this very important topic with Fransa Katz, our PnP Pharmacist. Now, cervical cancer is the second most prevalent cancer, second to breast cancer, to affect women in South Africa. A woman's risk of developing cervical cancer is 1 in 31. Each year, 6,700 women develop cervical cancer. So good morning, Fransa.
Good morning.
Good to have you here. Firstly, Fransa, what exactly is cervical cancer and how does it come about?
The cervix is the lower part of the uterus. So when cancer appears in that position, then you would say it's cervical cancer and not cancer of the uterus. It's usually caused by the HPV virus. HPV virus is a virus that you contract when you're in contact sexually with somebody else who already has the virus. And what happens is the virus then causes the cells of the cervix to start changing. So initially it will just be cells that are changing in appearance, but that can then develop eventually into a tumor and into cancer. So that would be the main cause for cervical cancer.
So there's lots of education on how to check for breast cancer and how to, make sure that you get yourself screened. How is cervical cancer diagnosed and how do people know if they have it?
The main thing that women need to understand and remember that they have to go once a year to their doctor or gynecologist for a pap smear. That's what the test is called. And usually when they go for their pelvic examination, the doctor would automatically do a pap smear. And what happens is he actually takes a small sample of the cells of the cervix that is sent away to the laboratory, and they will then look under microscopes and see, are there any changes in the cell the way it looks? Should there be changes, then they can investigate further, maybe do a biopsy and check, are these cells busy changing into cancerous cells or not? So by having a pap smear, you can check once a year and be sure that everything's fine, or no, maybe there's a chance that I'm developing cervical cancer. So there is a way of preventing it.
Wonderful. That's what I wanted to know, if there is a way of preventing it. But let's say you haven't been able to prevent it. Can it be treated?
Yes, treatment, obviously, there's 3 different ways of treating it depending on the severity, if it's already developed into cancer or not. It would only be through surgery, radiation or chemotherapy. So just the same as with breast cancer, your best thing is to screen for it, to go every year and make sure that everything's okay. Because if that is caught very early, then they would maybe remove the cells before it develops into a cancerous tumor.
Okay. Tell us more about the vaccination of cervical cancer in South Africa.
That's something new.
Exactly. How much does it cost? How is it administered?
Okay, it's pretty expensive.
Okay.
There are 2 different types of vaccines that both do the same, but there are 2 types available in South Africa. And children, girls from the age of about 10 up to women of about 26 can go and be vaccinated. And what it does, the HPV virus has many, many strains. There are about 100 different strains of this particular virus. But the vaccine will then build up an immunity against the strains that specifically cause cervical cancer. So if you have a daughter that's 10, 11 or 15 or whatever, you can take her and have the vaccination done and know that you are giving her this gift of having a far smaller chance of ever getting cervical cancer. As I said, the way you would administer it, it's about 600-700 rand per injection, but you have to have 3 injections. Even if you do have the vaccination, which is wonderful that it's available, you would still have to go every year and have your pap smear and still have it checked.
Yeah. I think the message that we're trying to get there is that women just need to put themselves first. You've got to make sure that you take care of your body and that you're knowing what's happening in your body as well. That's important, right?
Absolutely.
Wonderful. Thank you, Fransa, for joining us once
It's a
again. And of
pleasure.
course, knowledge is power. It is important for
Yes.
us to take responsibility for our lives. Well, it is Cervical Cancer Awareness Month. And like we said earlier, women need to have regular checkups. Put your health and wellness first so that you can live a long and healthy life. For more advice on cervical cancer vaccination, you can visit your closest PnP Pharmacy.
Goodness can be found in encouraging greatness at the Junior Runners Academy in Soweto. PnP, always there for you.